See that? Right there. That means it's recording. That means that you should not interrupt me and ask me if it's recording. Okay? Oh, you can't see that? Oh.
I mean, you can barely see it on the black. But...
Well, shit. I don't know how to move that thing. Okay, so maybe you'll just have to ask me, but don't ask me 5 times because I'll get pissy. It will. Okay, especially if you're late. If you're late, just assume that things must have gone well when you weren't here. Okay?
Is the circle always there if something changes?
Nope.
When it's, oh, okay.
No, it's not there at all.
I'll look for a half circle.
Okay, look for a half circle. I believe in you.
Thanks.
Lauren can do it. You can depend on her. It's all on her, guys. Right? It's all entirely her responsibility for the rest of the semester. No, I'm just kidding.
There's 2 semesters of backup already.
It's true. There's already 2 semesters. Actually, I'm going to take down one of them, but yeah. I have to make room on my YouTube channel or they make me pay.
Oh, shame.
Right? And I'm not going to pay. So I want to revisit a couple of things before we get into the material today. So first, everybody got into melanieb.com? Yeah? Everybody's good with that? All right. So we'll look at a couple of things on that today. How about your lab website? Everybody good with that? Okay. Please notice I just added these yesterday. I got more open lab times for Jordan campus. So now there are 9 open lab times per week, starting at 6:30 in the morning, ending at 10 p.m., including a Saturday one. So when you tell me that you cannot make an open lab, I am going to know that it is not a priority for you, okay? Because if you can watch 3 hours of Mrs. Maisel, you can go to open lab, right? You probably could. Now, it's not required, right? But it's a good way to reinforce and make it more likely that you're successful. So there's the open labs right there. Let me just tell you a couple of other things that I didn't tell you guys last time. Did I talk to you guys about your lab instructors last time at all?
No.
Okay. They're the best lab instructors that I can get for you, and they're pretty fantastic. And a lot of them are pretty damn brilliant. We've got nurses, we've got retired neuroanesthesiologists, we've got physical therapists, we've got clinical researchers, we've got research academics that are doing this. And they do it because they like teaching, right? Because ain't nobody going to get rich from teaching. But they're really good at it, and you really should take advantage of your lab time. Some of you will decide to leave early during lab. I'm going to go ahead and tell you that I had to fight tooth and nail to get that lab to be 3 hours long, and it is 3 hours long because students told me that they needed it to be longer. It used to be 2 hours longer. That said, some of you guys will leave early every time. Your expectation if you leave early every time is that you are not going to be an A student because you are not utilizing your resources. But you're a grown-up and you can make your own decisions, right? If you leave early once, nobody cares. If you leave early 5 times, I would probably just assume that it wasn't important to you. So that's the lab information. 2 more things. We are going to do every damn thing we can to give you the opportunities to be successful. Some of our lab aides are leading a study group. There will probably be another one. This is the one that they've got set up so far. If the time doesn't work for you, realize that these are students and that's the time that works for them. So you can either go to it or not go to it. I'm going to see if I can get another group to do one on Redwood campus. We'll see. I don't know. Depends on them. And then the other thing is that one of the lab aides last semester set this up, and it's pretty badass for those of you who are who have Facebook. Apparently young people don't use Facebook, but you've got to get on there because that's how you talk to Aunt Becky, right? You know that. That's how you talk to her. They made an online study group for those of you who are super busy, and it's really, really good. Look, Amanda just posted a practice quiz, yes? And the practice quizzes, she says, list the name, function, and location for each tissue. She'll tell you if you're wrong when you answer them in the comments. And she monitors this. Again, this is led by lab aides. If you are nasty, I'll kick you out of the group. Okay? Don't post any stupid crap in there. Jokes are great, though. They're funny. I like them. Okay. So this is the lab aid led study group. I'll go ahead and show you some of the stuff that they did last semester. She just posts stuff, and then you get to answer it and figure out whether you got all the stuff right, and they'll tell you whether you did. So if that's a way that you might consider studying, you can do that if you want to. You can join it if you want to. All right, so that is that. One last thing I want to talk about before I leave the lab page is cadavers. Let me take a minute to talk to you guys about cadavers. Okay, so a couple things about cadavers. You guys, did any of you guys meet the cadavers this week? Okay, some of you guys will, and some of you won't. Some of you will have a little bit of a hard time with the cadavers, and some of you will be fascinated, and both of those are normal reactions. But I want to tell you a little bit about sort of the history of where we get these cadavers and all of that kind of stuff, and then my expectations for you with cadavers. First off, the history of cadaver use for education is pretty sketchy. It actually is. There's a lot of sketchy history of cadaver use for education in med school that goes back to Eastern and Western Europe. That's the ones I know about. I'm sure it goes on elsewhere. They used to use indigent people when they died and didn't have enough money for burial. They would be used for med school cadaver dissections. They would use criminals who were executed. They would use cadavers from any sort. There were grave robbings and things like that. Here in the United States, still cadaver use has a pretty damn sketchy history. During slavery period, it was very, very common to use slaves for cadavers. So that, and we're going to acknowledge that there is some sketchy history of cadavers. However, our cadavers are body donors, and I'm a body donor. They came from people who decided to donate their body for education and or research while they were alive. For instance, my husband could not donate my body. I have to sign the paperwork when I am alive in order for that to occur, okay? And our cadavers, the vast majority of them are middle class people, quite often doctors and educators, right? People who have benefited from anatomical education quite often will give back to anatomical education. We have no indigent populations. It is not legal or ethical in this country any longer to use body donors that did not donate their body willingly. And it's important that you guys know that because that's what they wanted to happen. It's what I want to happen. I got some weird crap going on. I hope that somebody looks at it and thinks it's a freaking Cracker Jack box once they get in there. Like, oh my God, what the hell's going on in here? Like I do. I'm like super excited once I get in there. But that said, these donors, this was a kindness on their part, and I expect you to be really, really respectful of these body donors, meaning that don't damage anything on purpose. Be very gentle with how you interact with them. You can touch the cadavers, and there's a lot of learning that can happen through touch. Wear gloves, because yuck, okay? You're not going to get any diseases because they've been formaldehyded to get to death, but yuck. So wear gloves and touch things, but you can break stuff, and when you break stuff, you make that learning tool poorer for everyone. Historically speaking, people have broken things on purpose because they didn't want to be tested over it. I will super glue that shit back together. Don't think I won't. And then it'll just be harder, okay? I will. There's like a gluteal nerve back here that's really hard for people, superior and inferior gluteal nerve. It's really easy to break. And so people have just used to pop it. I just stitch it back together or glue it back together and then ask you anyway, okay? So don't do that. I know that you wouldn't. It sounds absolutely crazy to hear that people did, but they do. In addition, these donors deserve the respect that you are not absolutely under any circumstances allowed to photograph anything related to a cadaver. As a matter of fact, if your phone is out during lab, you should have had special permission for your phone to be out during lab, okay? And why is that? Well, because these donors came from this area, yes? And they do not want to be displayed on the internet, yes? and it's completely disrespectful. Has that happened before? Well, I wouldn't be talking about it if it hadn't. Somebody Snapchatted, right? Picture of her and the donor, right? And that's one of the few things that'll get you kicked out of the class without any discussion whatsoever. So, and of course it was Snapchat, and we're like, we'll delete it. She's like, it's already gone. I'm like, I have no idea who has that picture now. So be really respectful of them. That said, with the exception of the normal apprehension that people have with cadavers, don't be afraid of interacting with them. So for instance, in order to find out where these two muscles are that are on top of one another, I can gently put my finger under, you know, and make sure I can tell the difference between the two of them. Do I want to yank? Right? So no stroking, no poking, no pulling, right? So interact with it. So you can damage them. And if you damage them, it's the same learning tool, just poorer quality is what it is, okay? So if you have qualms with dealing with cadavers, realize that you're not the only person that has those. And a lot of times those go away with a little time. But if they don't, feel free to ask me or your lab instructor to give you some one-on-one time so that you can learn a little bit more and get to the point that you're comfortable with them. Is that okay? Okay, we're getting a new one today and delivering 2 back to the Body Donor Program. One of the other things that the Body Donor Program does is when a donor donates their body for this use, all of the expenses are taken care of for the family, and there's a memorial service for the family as well. As soon as the body is returned. I don't know if you guys have ever seen it, but there's actually a monument right outside the library downtown called Celebration of Life, and has an inscription of every single body donor from the University of Utah's program as they were used. So it is cool, yeah. And it's kind of a really fortunate situation that we're in. So that's cadavers. Last thing is, how about top hat? Everybody okay on top hat? Everybody get in? Okay. Somebody remind me instead of me reminding you when your quiz is due.
4 days.
Before class next week, but not like right before class. It will start counting down minutes until it's due, right? So you keep an eye on that, not me, okay? So you could have already had it done. It's not like it was hard. It was a freaking syllabus quiz, people. So top hat's not hard to use, right? It's not difficult to use. And a week from today, you'll have your first in-class quiz. So that makes sure that everybody has top hat working before then and it's tried, all that kind of stuff. Everybody good? Okay, do you guys have any questions or any issues that you ran into?
Did you email them to extend it? Or did you not?
No, I haven't. I haven't done it yet.
Did you get my email?
I did,
Okay.
but I'm busy, so you might have to babysit me for a minute.
No, you're good.
Okay. Yeah, it's important to me, but
No.
like there are 17 other things that are
I just didn't send it from my
above
slip
it.
one, so
No, I got it. I got it from you. Okay. All right. So feel like I'm forgetting to tell you something. Oh, just one last little thing. If you're like curious or interested in the use of cadavers in education, I linked this article for you. This is a National Geographic article about the use of cadavers in education. I'm not going to test off of it or anything, but if you're just a curious soul that wants to know a little bit about that, you can read that. I think it's interesting. It goes a little bit through the history and it talks about what's happening now. There's a big movement right now to stop using any specimens in education at all. And people are trying to say that you can get exactly the same education with animations and digital resources. The only people who believe that, people who are not anatomists. Because you can't quite get the same. I mean, I'm your surgeon. Are you super comfortable? Because I've actually never seen a real critter before, but I'm pretty sure I saw a 3D. I had a VR experience. You comfortable with me? You want me to start on you right now? You want to volunteer to be first? Believe it or not, PETA, regardless of what you think about PETA, is one of the big pushers for stopping specimens, even human specimens. They're trying to stop all kinds of specimens being used, and every once in a while they come and present it at our conferences that we talk about. It doesn't usually go very well. Okay, so what we are going to do now is we're going to do this set of notes. When we finish this set of notes, that'll be the material for your first quiz, including all the stuff that I talk about today. First quiz will be a week from today. Okay? A week from today. So let's talk about where we are. And this is the same stuff that you guys are starting on in lab this week. So it'll have overlap with lab. So I want to talk first about what about anatomy is kind of challenging at the beginning. What's challenging at the beginning, I think, is that it's all in a different language, right? So regardless of what language you speak, you don't speak Latin, yes? You might have taken Latin in high school, and if you did, you got some good parents. Who took Latin? Anybody? Oh, I want to high five your parents because that was brilliant. I keep trying to get my son, he's like 12 now, and like a foreign language is about to start. I'm like, you're taking Latin. He's like, all the cute girls are in French. I'm like, you don't want a cute girl? You got crap to do. You want a smart girl. She'll get cute later. Just wait, right? So Latin, which I should have taken and did not. I was a redneck. What the hell did I know? And Greek. And anybody speak Greek? Okay. So regardless of the fact that some of you on the video told me that you spoke 7 languages. You are such interesting people. That video, like, I got all teary because you're so adorable and humans are so damn interesting. My husband's like, you are such a freaking marshmallow. So anyway, nobody told me that they spoke Greek and Latin regardless. And the language is a barrier, and it's a barrier for all of us. However, if you speak a language that has Latin roots, you get a little bit of an advantage, right? If you speak Spanish, right, you're going to see some overlap if you speak French, but not in everything because it's just Latin roots. So what do you do about the fact that you're taking a class that almost all the important nouns are in a language you don't speak? Well, what I'm going to do right now is I'm going to help you get comfortable with that by making you uncomfortable for a minute and making you learn a subset of Latin prefixes, roots, and suffixes that you're going to run into all semester. And how many of you guys already found this? Good, great. Okay, so here is this is part of the material for your first quiz. So here's the deal. You probably know some of these, especially if you are a reader, but some of them are so specific to anatomy that you might have never run into them before. Like, you're probably not going to run into the word lacrimal no matter how many novels you read, right? But you're not confused by the fact that the word macro, right, means large, right? So these are the most commonly used prefixes, roots, and suffixes that I could find. Is it all of them that we're going to run into all semester? No. But it's a subset of the ones that I know are going to sort of repeat. So how am I going to quiz you over this? I am not going to ask you whether macro means large. What I'm going to do is I am going to throw words at you that are unfamiliar, probably, words, but they're made of roots that you just learned, and see if you can figure out what it means in context. Does that make sense? So to give you some context, some confidence to keep going. So here's an example. There's a word that you're going to run into this semester that I doubt you've seen before unless you work in a hematology lab or something, and that is the word hematocytoblast. Hematocytoblast, okay? So you might not know what that means, but does anybody know what the prefix hemato means? Blood. Hemo and hemato both mean blood. Cyto, everybody knows, right? Cell, yeah, and blast? It means bud or precursor. So it doesn't tell you exactly what you want to know, but it's blood cell precursor. Does it surprise you at all that that is actually the cell within bone marrow that makes all of your blood cells? Doesn't surprise you. So how would I ask you that? Well, I wouldn't assume that you would know that it was the cell within bone marrow that makes all of your blood cells. But I could put, oh, is this the cell, as some of the choices, the cell within bone marrow that makes all of your blood cells? Or is this a liver cell precursor? Because the prefix hepato means liver. Yes? So I'm going to throw unfamiliar real terms at you that you can figure out by context, right? Does that make sense? To encourage you to read this subset. And what's the objective here? The objective is you don't have time to look every freaking unfamiliar word up in the glossary, right? You never get a damn thing done. What you have to do is have the confidence to keep going, right? You're like, I'm pretty sure I know what this means in this context. I'll reinforce it later if I still don't get it. Maybe I'll look it up, right? So you're going to learn this subset of prefixes, roots, and suffixes. And do you see hepato is liver and hemato is blood? Right? Do you see that? Okay. So you're going to learn, not surprisingly, osteo means bone. Pneumo means air. So you're going to learn these, and I'm going to throw some of the terms on the quiz at you that are like these put together. Everybody okay? Okay. And the idea is you're going to be a little more confident than most people to like keep going. You're like, I'm not sure exactly what it means, but I got an idea, right? And we'll see. We'll see if it'll allow me to keep going. So that's the first thing that you guys are going to do, and the first thing that is we're going to talk about that's going to be on your quiz. The rest of your quiz a week from today is going to be over the rest of this set of notes, right? This entire set of notes, plus those prefixes, roots, and suffixes. And it's going to be an in-class quiz next Thursday, and it's going to be top hat, right? So take care of your whole top hat business. Make sure you feel confident with it. Note to self, I don't know if I told you guys about this last time. Did I tell you that the Wi-Fi really sucks for using top hat? Okay, I'm going to go ahead and say it on recording. When you are using a phone instead of a laptop or a tablet, don't use Wi-Fi for top hat. It will drop it in the middle of your quiz. It's a jerk. Just turn off the Wi-Fi and let it use your data, but it only uses like the teeny tiniest amount of data because it's sending me a letter most of the time. Right? It's not sending me an image. Good? Okay, so we are going to start talking about what anatomy is like, big picture, and then we'll get into some specifics today. So let's talk about what anatomy is and then my approach to anatomy, or sort of Slick's approach to anatomy. Anatomy, and that means to cut, okay? So we're sort of looking at the structure of things, but we can't see everything on the outside. So a lot of times we need to do some cutting to get in there. Does that make sense to you guys? Okay, so this is human anatomy. Note to self, though, you're not that much different than your dog, right? You've got basically the same muscles in the same places, all of the same vessels in the same places, and almost all mammals are very similar to almost all other mammals. This just happens to be a human anatomy course. By the way, my background is in evolutionary biology, so I make a lot of connections between other organisms because I think it's interesting. Anatomy is also sometimes called morphology. I bet you kind of know what morpho means. What does it mean? Shape or form, right? So it's like the structure of things. So what do we do as far as anatomy? We start off in this class right after this set of notes with a microscopic anatomy. We don't do cytology in here really much because you did that in 1610. But that doesn't mean that I, for instance, could say, hey, look at this histology slide, and this is simple cuboidal epithelium, and you need to know that that thing inside the cell is a nucleus, right? And that's the cell membrane. But other than that, we don't really do cytology in here anymore. We do start with histology, and you guys told me last time that you knew what that meant. Yeah? Which is? Tissues, the study of tissues. Histology is not everybody's favorite. But it's what we're going to start with, and it's really important for reasons that I will explain. As we get into histology, I'll also try to make some connections. Every single time we go to a new body system, although it will annoy the crap out of you, I'm going to reinforce the histology of that body system. So you'll think we're done with histology, and you're going to breathe a sigh of relief. But then when I get into cardiovascular system, I'm going to remind you that the heart is made out of primarily cardiac muscle tissue. And I'm going to say you're responsible for that slide again. Because if I don't do that, you will dump the histology and never think about it again, right? And then again, I don't really want you to be my clinician if you only know the big interesting stuff, right? I want you to like know it as much as I can. So we will kind of reinforce it throughout the semester, but really it's really concentrated in the beginning. Okay, so that's the study of tissues. After we leave tissues, we're going to get into the stuff that most people really like, which is gross anatomy, also called macroscopic anatomy. So gross does not mean yucky and probably smelly, although yes, quite often that's true. But it means visible with the naked eye or the unaided eye. You don't need a microscope, right? So gross anatomy usually starts at the organ level. Because although you can't see cardiac muscle tissue, you can see a heart, right? And it goes all the way up to the like body, the whole body level. So that's gross anatomy, and most of the rest of the semester we'll be spending on gross anatomy. Gross anatomy generally involves dissection, but you don't do all of the dissections. You do some of them, because, I don't know, dissection's really fun. I love doing dissection. But, I mean, let's be honest, are you confident enough to dissect a cadaver? No, you're not. So we do those dissections for you. You have what's called a prosected cadaver, which is a cadaver in which we did the dissection so that you could see everything and study it. Prosection is really, really labor intensive. Before we started the prosection class, did you guys have a prosection class? I did? No, I didn't. I got one nod. Okay, the prosection class is a class that's really rare at an undergraduate level. Here, if you are a total badass in anatomy, especially if you were also one of my lab aides after, you can earn a spot in a class that prosects a cadaver. That class actually starts today for this semester. We get a body donor from the body donor program, and throughout a semester, 8 to 12 of them will prosect that cadaver over the course of the semester, and then that cadaver rotates into the anatomy lab. We are one of two year prosection classes in the entire country. So it's really, really rare for people to get that experience at this level of knowledge. And there's only a few spots because how many people could you fit around a cadaver, right? Right? So we prosect the cadaver. Before the prosection class started, here's how much time it took to do that. It took 8 faculty members about 40 to 80 hours apiece, depending on how fast they were, to do one cadaver. So labor intensive. So not only do we take everything off, but if, for instance, you wanted to look at the forearm, even if the skin wasn't there, the muscles and nerves and vessels are not really obvious. What we have to do is separate them so that you can see the individual structures. And we have to do it carefully enough that we don't damage things in the process. So it takes some skill. I think it's absolutely like one of the most fun things on earth. But I'm a weirdo. And my husband, we have been married for 13 years. We've known each other for 24 years. He's never seen a cadaver. He's like, I don't even know what the hell you're talking about. Please shut up. So he's still never seen it. My little boy has. He's like, this is so cool, Mom. My husband's like, I'm never, ever coming up there unless you are on the floor and I have to come get you. That's the only way I'm coming into that room. We do dissection. Now, you guys get to do a few dissections if you want to, okay? They will happen in your labs, but if, for instance, you were super uncomfortable with doing one and she wanted to do it, she can do it and you can watch, right? Okay, so what are you guys able to do? Well, the first one's not very interesting. The lab aides usually do it for you. It's just a long bone dissection so you can see all the soft tissue that's associated with bone. But then there's also a fresh sheep heart dissection. Surgeons practice on sheep hearts because they're so similar to human hearts, and I get them from the slaughterhouse so that you guys can do them, right? And the texture is really, really super similar, and they're very, very fresh. It's really cool. And then we also do a cow eyeball and a sheep brain. So, and you guys can be as engaged in those processes if you want, as you want to be. Regardless of whether you're engaged in the process or not, however, it's part of the learning outcomes of the course, so you would be tested on it. Does that make sense? So it's not something you can just say, I'm not comfortable with any of this, I'm not going to do any of it. It's still one of the learning outcomes that you agreed to. But nobody's going to make you dissect something if you're really uncomfortable with it. It involves dissection. There's 2 different really common approaches to teaching anatomy. The one that I think I told you guys last time that we use in here, it's called systemic anatomy. Like we do one body system after another, skeletal, and then muscular because it attaches to the skeleton, and then nervous, right? And so the idea is that by doing systemic anatomy, you sort of get a big picture understanding of how the systems work with one another. That's how most undergraduate anatomy is taught, which is systemic. Most graduate level or post-secondary anatomy is taught the other way, which is regional anatomy. What's regional anatomy? Regional anatomy is, if I were going to PT school, for instance, you're going to have to take anatomy again. It's not totally different anatomy, but it's a different approach to the same anatomy. So what I would do is anatomy of the upper limb, and then I would learn, for the upper limb, I would learn bones, muscles, nerves, vessels, everything associated with the upper limb. And you can see how that would be super relevant to, for instance, somebody who is going to do PT for the hands, right? Super relevant. It's not a different course, it's a different approach to the same course, right? and it's usually taught differently at that level. The U, interestingly, is one of the few undergraduate institutions that teaches regional anatomy as the undergrad course. They approach it regionally. And Mark Nielsen's one of my colleagues, and he's the anatomist up there. He's a great anatomist. He does it that way. I don't know why. He thinks it's better that way. Everybody else doesn't understand why he does it, but he does it, and he's really good at it. So it's another good way that you could do it. So that's regional anatomy. If you end up going into med school, you're going to take anatomy again. Is this a waste of time? No, because that class is freaking hard. Do you not want to do you not want a little leg up? No pun intended. On doing well in anatomy. That was totally unintentional. Okay, there are other branches of anatomy, guys. Some of them I suck at. Some of you guys will be way better at than I am. Surface anatomy. Surface anatomy is using external landmarks to sort of know where internal structures are. So you know when you go to the doctor and she like lifts up your boob to try to stick the stethoscope in there and listen to your heart, that is because your, I mean, if you don't have a boob, then she just does that. But, okay, it's way easier. But that's because the place that your heart comes into contact with the anterior thoracic wall is between ribs 2 and 3, just left lateral of your sternum. And so you can hear it really well there. What other anatomical landmarks do you use? Well, if you do an epidural injection, you're going to want to suck it up below the spinal cord. The spinal cord ends at about L2. They count down below L3, L4, before they actually do an epidural injection because they don't want to damage the spinal cord, right? If I have a pain right here and I go into the doctor, what will the doctor suspect? Appendicitis, because that's where my appendix is, right? You can use other things like if you want to know where your urinary bladder is, if you didn't gain that 10 pounds that a lot of us gain over the holiday break, right? And you can still feel your anterior superior iliac spines. If you draw a line right there, urinary bladder's right below there, okay? So that's surface anatomy. I suck at that because I don't deal with living people. If I want to see something, I just take off the skin and look at it. That's all I do, right? But you guys are going to be good at that. You're going to be good at surface anatomy, and please do get good at it so that I'll have some confidence when I see you, right? Other branches of anatomy, developmental anatomy and embryology. That's like how you went from a zygote to this stage, right? To, on average, 100 trillion cells as an adult. I don't do a ton of that, except for when it really like reinforces. I do it in the reproductive system because I find it fascinating, and it's almost never taught that, for instance, the two of us right here, who are two different sexes, we were both born with all of the plumbing to either be male or female, right? So how did you get to be a sex at all? All of us started out with a vagina, so we should really be nice to them, right? Don't you agree? Just as a general rule, we should definitely be nice to vaginas. So the process of becoming male or female, the sexes, is really kind of interesting. And to me, just so you know, philosophically, not that you care about this crap, but anything that I can possibly teach you within the context of this class that is relevant to this class, that makes you more compassionate or empathetic to a person that is different than you, I will absolutely figure out a way to put it in there, okay? Whether it's sex, whether it's sexuality, whether it's culture, whether it's race, whether it's anything, I'm going to stick it in there so that you'll realize you ain't that different, people. I mean, your mom told me you were special, but that's not what she meant. Okay, so pathological anatomy is also some kind of sometimes really interesting. Most patho is a phys problem, like a functional problem that makes it weird. But every once in a while, it's an anatomy problem, like, for instance, scoliosis. Isn't that an anatomy problem, right, that impacts function, right, just the anatomy? How about a cleft palate? That's an anatomical abnormality. How about having one limb shorter than the other? Improperly developed musculature. Those are all pathological anatomy. Now, am I an expert on those things? No, but I throw them in where I know about them because it sort of reinforces the normal anatomy, and I think it makes stuff more interesting. So that's sort of the patho aspect. All right, so gross anatomy introduction is where we're going to start now. Oh, by the way, if I do a really good job with getting you guys not just to memorize anatomy, but also to really understand anatomy, it really leads you to automatically think about the phys. So if I give you such a good description of the kidney that you start thinking, oh, then it probably does this there. That's what I'm trying to accomplish. Like such a good description of the anatomy that you automatically start coming up with the phys questions. And of course, I sprinkle phys in here too because it makes everything stick better, right? Like if you just teach me the name and not why I have to know the name, then I'm like blah, 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 blah. A good basis in anatomy leads to an understanding of physiology, and most of you guys will take phys after this. Every once in a while somebody takes them backwards. Who did that? Which one of you guys? Oh, she's going to be smart though. It's fine. A lot of people, actually one of my colleagues always tells people to take them backwards. And I love her very much, but she doesn't teach both of them. So I wish she would stop telling people so because she thinks that phys and 1610 are so closely related, and they really are. But it's really hard for me to teach people physiology when they don't know the names of the parts. You know what I mean? Like when you got to cardiovascular physiology, was it kind of challenging because you're like, oh, where the hell are these valves? What's going on? And why does everyone know this but me? But she got it. She's good. Okay, so let's talk about gross anatomy introduction. All right, so here's the deal. We have to have a common set of assumptions and terminology, right? Because worldwide, people are studying anatomy and physiology. And let's say I'm in the United States, and she's in Israel, and you are in China, and we are all experts, and we need to share our expertise with one another. We have to have the common set of assumptions and terminology, or else we're going to continue to reinvent the wheel, right? So the first thing that you have to understand is that anatomy has a common set of assumptions, and the first set of assumptions is that I am always talking about a person's anatomy from the same perspective. Regardless of whether laying down or up, what I mean is I'm always going to assume that when you write about someone, you're assuming that they are in anatomical position. Anatomical position means that the assumption is always that with humans, anatomical position, this is anatomical position, not because it's comfortable, but for a reason I'll describe in just a minute, okay? It is, if you're standing up, toes forward, palms forward. That's anatomical position, okay? That means that for the three of us, the navel is always a what structure? It's always anterior, right? Even if I was laying down or my body was in a different position or whatever. So that's the common assumption, right? We start talking about structures, we always assume that regardless of the actual position, if I refer to anterior, I'm always referring to this as anterior. Does that make sense? Okay. So this is anatomical position, but of course not all of your patients or clients or anything are going to be standing up, right? So there has to be an anatomical position laying down. There's actually two laying down, okay? Still, same basic relative position, just flop them one way or the other. Anatomical position when you are face up, still palms forward, palms associated with the belly side. That's called supine, yeah? Okay, and same anatomical position but face down is called prone, because you can't get to everything from the front side, right? Okay, and the way I remember this, because I'm a redneck from Texas, if you're supine, you can drink soup. If you're prone, you pull it out, right? Whatever. Doesn't work as well if you're not a redneck. Okay, so why? Why this weird anatomical position? Okay, because if you stand like this, you can tell that it's like not your natural way to stand, right? It's something like this. So why do we flip it this way? It's because your anatomy is damn near the same as your dog's anatomy. Okay, just different slightly proportions, but for instance, you have all the muscles and everything in the same positions, almost all of the muscles. And we are actually the exception in mammals and not the rule. Most mammals are quadrupeds, aren't they? Yes? Aren't most mammals quadrupeds? And we are one of the few bipedal mammals. So what we did is we learned all of the anatomy based on the common, and then made the exception fit the common. That means that with my dog, I have two golden retrievers. They're so freaking cute. The little one is just a puppy. His name is Superfly. Okay, you ready? So the old one is Stinky, but we still love her. So if on my dog, these muscles right here correlate to his belly side, yes? Muscles right here, okay? In me, I have the same muscles. They correspond to my belly side. Do you see? If I was doing anatomical position in a human for real, it's actually this. But that takes up too much room in a textbook. Okay? Right? So why do I care? Because all of the same muscles that I would find on my dog, or my hamster, or my cat, or a chimpanzee, right, are going to be right here, and they will correspond to the belly side of my body, right? So we just sort of flip ourselves so that we correspond to the rule, because we're the exception, right? Does that make sense? Not because it's comfortable, right? So this is the anterior portion. This is anterior. Even if it's flipped, is it still anterior? That's the assumption I was talking about between us three experts. I gave you guys PhDs right now. You're welcome. Okay, ready? The assumption here is that if I am talking about anterior forearm musculature, even if the patient is like this, even if you're looking at a cadaver that's like this, it's still right there, and we all know it. Does that make sense? Okay, all right, so anatomical position. Now, the other thing is that we in all mammals have what's called bilateral symmetry. Yeah, if you're a starfish, you have radial symmetry, meaning there's a lot of different ways to be symmetrical, but you're not starfish. If you are a human or any other mammal, any other vertebrate really, you're going to have bilateral symmetry, which means that there's an imaginary midline that you could use that would divide you into mirror image left and right structures. Now, not everything is mirrored, but most things are, right? You don't have two livers, right? But pretty much externally, especially, almost everything is mirrored, right? Okay, that means that because you have a midline, you have lefts and rights for any paired structure. Does that make sense? Okay, so for left and right are really important in anatomy. And here is the argument that everybody has, and that is that Lauren and I, if I'm talking about left or right and you're the patient and I'm the clinician, never come to me for any kind of care, please. I'll be like, suck it up. You'll be a cadaver anyway at some point. It's not fine. Okay, I know my weaknesses as a human. Okay, so if Lauren and I are talking and she's describing a pain to me and I'm actually writing it down and she's describing a pain, put your hand right here. She's describing a pain right there. Do I write down that it's on her right side? No, I need to empathize, yes. And if you were like me and you're really spatially challenged, and I totally am, I have so much trouble with like spatial organization, I actually have to physically flip myself around to figure out what the hell side of anything's on. And it's not going to be just you. And some of you guys are laughing because you're really good at that. Well, I read 45 books last year, so I don't know. I got some other skills. So you flip around or whatever you have to do, but it's always the patients or the specimens or the cadavers left or right. Nobody cares about your left or right, right? So there is only one left or right. My 18-year-old, who will argue with a fence post, insists that left or right changes based on the person. I'm like, what the hell are you talking about? He also continues to argue with me about clockwise versus counterclockwise. For some reason, I'm like, if it's going this direction, it's clockwise. He's like, at some point it's going that direction. I'm like, oh my God, Gavin, zip it. But it's just his personality. We just get the children that we deserve, don't we? Yes? Okay. Okay. So lefts and rights are always from the specimen or the cadaver being viewed. So here's the deal. I'm going to make you use left and right correctly by telling you that I reserve the right to count it completely wrong if it is a paired structure and you leave off left and right. So for instance, at some point this semester, if I said, identify this part, and you said, that is the sclera of the eye. I can count off the whole damn thing if you do not put, that is the sclera of the right eye. Why would I do that? Because I'm a bastard? No, because have you not read the articles about people getting the wrong damn kidney taken out? The wrong eye operated on? The wrong knee operated on? Where does that start? It starts right here. That's where it starts. So am I going to do that to you every time? No, because I'll only have to do it to you once, won't I? Just once. That's all. After that, you're like, oh, damn, Melanie, you were serious. So it's not correct if you leave off left and right on a paired structure. Go ahead.
I've written before on my body like this side because I have like a totally just forgetful neurosurgeon, and I was doing injections on my back. I know, and but he's brilliant. And he keeps
not
saying,
uncommon.
"You're on the right side today, right?" And I'd be like, "No, it's left." And then 10 minutes later, "It's the right side, right?" "No, it's left." So I literally like, because I was just like, yeah.
Well, apparently I don't know this because I haven't had this, but maybe some of you guys have had this experience. Now what they require the patient to do is like they'll give you a Sharpie and they'll say, I want you to mark the knee that we need to operate on. You mark it, you initial it. And is it because they love you? Yeah, exactly. They're trying to eliminate velocity. Like, she signed it, I took a picture, right? I'm sorry that both of her knees are broken now, but...
It sucks working in a PT clinic, too.
Yeah.
Sometimes, like, I'll try to go ice up somebody's shoulder, and then they'll be like, oh, it's my hammer. That one's like the hurt one. It's
Just listen to them. I mean, what do we know about people's pain? Go ahead. Oh, she was just stretching. Okay. Any questions? Okay. So that's the left and right thing. All right. So now this set of terms is like a general set of terms that you use all semester long, and some of them are so like familiar that you're going to know exactly what they mean, and some of them are really kind of anatomically specific. These are pairs of terms that you would use to describe two different things with reference to one another, and these are called orientation and directional terms, and some of them are super easy. Like, nobody's going to be surprised what superior and inferior mean, right? Okay, but superior and inferior, let's just get into the habit of using them, even though it's pedantic and we can do without it, but I need to show you how they're related to another set of terms. My navel is what to my nose? Superior. No, you said superior. I was like, how did you guys confuse me already? My navel is what to my nose?
Inferior.
Yes, my navel is inferior. And my navel is what to my pubic bone? Superior. Good. Okay. Now, that's good, and everyone knows those terms, but they're not broadly applicable if you're talking about like comparative anatomy, because let's think about this. Now I'm Superfly, my dog. Okay. Is his navel superior to his nose, inferior to his nose? No, that's not the relationship, is it? Right? That's not a true relationship between the two. Does that make sense? So if you want to use a term that's really broadly applicable, you would use a different set of terms, and that's cranial and caudal. Cranial means toward the head. Caudal means toward the tail. Yeah? Caudal fin, if you fish, is back here. Now, let's do those same two terms with me and Superfly. I'm going to bring you guys a picture of Superfly next time. You're just going to melt and dog ovulate. He's so cute. You're like, well, I don't know what the equivalent is, but it's when you need a puppy instead of a baby. You know what I'm talking about, right? You saw a puppy and you're like, stop everything. We need a puppy. Okay. So now I want to use that pair of terms for the same thing. My navel is what to my nose? Caudal. Yes, toward the tail. Okay. My navel is what to my pubic bone? Cranial. Yeah? Is it true for Superfly too, both of those? Yeah, they are, right? They're consistent. So which ones will you use? Yes. It really depends on which clinician you run into, which textbook, right? It can use either one. The one that's like really, really dependable is cranial and caudal, but sometimes they'll use the easier one that people are used to using. So you just kind of have to understand that those terms are related, not identical, but related. Next sets are also identical, but not, are related, but not identical. And that is anterior and posterior. That doesn't surprise anybody. Assuming anatomical position, yes? Okay. My nose is a what structure? Anterior structure. My coccyx is a posterior structure, right? Now let's do navel, okay? My navel is a what structure? Anterior. My spinal cord is a what structure? Posterior. Now Superfly. Does that work? Are they anterior and posterior?
No.
They are not. There's a different set of terms that's more broadly applicable. Yeah? And that is ventral and dorsal. Ventral means belly side. Dorsal means back side. Because if you fish, what is this fin called?
Dorsal fin.
Yeah, that's a dorsal fin, right? Or if you like sharks. Dorsal fin. Okay, so ventral and dorsal. Ventral is belly side, dorsal is back side. Now let's do me and superfly again and see that it works. Your dog has a navel. Probably haven't looked around for it, but he totally does because he's a placental mammal. The navel is what? Use that pair. Ventral. And the spinal cord is? Dorsal. Okay. Still true for superfly? Yeah, still true for superfly. Does that make sense? Okay. So which one will you use? Yes. Ventral and dorsal is really, really commonly used. Super commonly used. But anterior and posterior is not going to confuse anybody, so you'll run into both. But for instance, in your textbook, you're going to run into, like when it gets really hard this semester, not impossible, don't drop, just hard, and you're starting to look at muscles, right? The hardest muscles for me are the forearm muscles. And interestingly, until you're really, really good at looking at them, once you take the skin off, the anterior forearm and the posterior forearm look really similar, okay? Super duper similar. So it's really important to read the legend because it will say, right forearm, comma, ventral view. Left forearm, dorsal view, right? And so then you've got some orientation as to what you're supposed to be looking for, right? So don't ever forget to read the legend because it's trying to make it a little easier for you. Okay, so they don't look identical, by the way. They just look really similar until you get used to looking at them. Okay, and then medial and lateral and intermediate, those are probably not very hard for you. Since we have an imaginary midline, okay, you can describe things as closer to it and further away from it, okay? If you're closer to the midline, then you're medial. If you're further away, then you're lateral. If you're between, you're intermediate. So let's describe three things. This is my iliac crest, that like swing part of your hip right here. This is, of course, my navel, and I've got an appendix scar right there. Okay? So let's describe them with reference to one another. My iliac crest is what to my navel? Lateral. My navel is what to my iliac crest? Medial. And my appendix scar is what? Intermediate between them. Yes? Medial, lateral, and intermediate? Good?
Intermediate means the middle.
Yeah, it's between two things that you are already describing as medial and lateral. But just so you know, it's not just used for the whole body with the midline of the whole body. It's also used for, like, here's my arm, right? And my wrist and my hand. I'm not going to do it for you so you can figure it out. Okay. In anatomical position, my pinky is a what structure? Get anatomic, it's medial, yeah. Oh, you tricky bastard. Okay, and my thumb is a what? Lateral structure. If I was looking at a figure and it said I am looking at the medial muscles of the thigh, where would those correlate to? Right, the inner surface of the thigh, yeah? And these are the lateral muscles of the thigh. That make sense? Okay, so those are used super commonly. You'll see medial, lateral, and intermediate all the time. Okay, this is the hardest pair because it's only used in specific instances. So I need you to listen and write down the specific instance in which you use proximal and distal. Okay, you only use proximal and distal for limbs or tubes, long skinny things. Okay, and I'm going to give you some examples. Limbs or tubes. Okay, so proximal means closer to the point of attachment, and distal means more distant from or further away from the point of attachment. Yet let's use a limb in which the point of attachment is super obvious, right? Nobody needs to tell you what the point of attachment for the arm is, right? You know what it is. It's the shoulder, yes? Okay, all right. So proximal and distal is used to describe things along the lengths of limbs or tubes. So proximal is closer to the point of attachment, distal is further away. So tell me which term I should use. My elbow is what to my wrist? Proximal to my wrist, closer to the point of attachment, okay? But my elbow is what to my shoulder? Distal. Do you see? Okay, all right. You can use them along your legs as well. That means that you don't use superior and inferior, cranial and caudal, for limbs of tubes. You don't, right? So if you're describing things along the lengths of limbs or tubes, using superior and inferior or cranial and caudal is incorrect, okay? So with your legs, you would use the same thing. But more importantly, why? Why this? Because internally, we got a hell of a lot of tubes, do we not? long, skinny things. And your tubes are not exactly curved the same as mine, and they won't even be curved my tubes won't even be curved the same after I eat a big meal as they were before. For instance, if we're talking about intestines, right? So the curvature of your intestine. But what happens is now she and I are going to be experts. Oh, I need to do a dude next time. There's just not that many of you. I promise I'll make you experts this semester. Okay? So she and I are going to be experts, and I am going to do the initial diagnostics. And what I think that there is a blockage or potentially a tumor in the small intestine, right? You're the specialist, so I need to refer somebody to you. And you know you ain't getting into a specialist tomorrow. It might be 2 weeks from now, right? Okay? So I'm going to write down or communicate somehow that I think that there is a tumor or a blockage in this particular location. I'm not going to describe it as like 11 centimeters below the stomach and 4 centimeters lateral of midline, because would it be in the same place when the patient got to you? No, it's not going to be in the same place. So what can I do that would be more dependable? I could use proximal and distal because it's a tube, right? And I could say, what's your last name? Al-Haddad. Okay, Dr. Al-Haddad, I think that there is a blockage or a tumor 11 centimeters distal from the pyloric sphincter. Yes? And it would still be in the same place approximately, right, by the time the patient got to her. So you find the pyloric sphincter. You might not know that point of attachment, but if I told you the pyloric sphincter, I'm pretty sure that she knows where it is, right? So she finds the pyloric sphincter, and she goes 11 centimeters distal. You might not have gotten it exactly, but it's less than 40, right? And more than 2, and you'll probably find it. So 11 centimeters distal, and then she goes and investigates that particular part. Does that make sense? So limbs or tubes are wiggly, and their position changes. So it's better to describe things along the lengths of them instead of using superior and inferior and medial lateral, right? So that's proximal and distal. That's when you use those things. Okay, so, and then last but not least, superficial and deep. And this is really easy. All you have to do is think about personalities or wounds, right? So I want you to imagine that you were a big fleshy ball, right? And a wound occurs. If it's close to the surface and doesn't damage many tissues, you would call it a what wound? Superficial, right? If it almost cuts you in half, then it's a deep wound, right? Does that make sense? It's not just used for wounds. You have a lot of structures that are layered on top of one another in your body, and you have to describe them with reference to one another. So here's an easy example. Skin, muscle, bone. You've been a human for a while. You know how those things are related to one another. So skin, muscle, bone on the thigh, right? My skin is what to my skeletal muscle? Superficial to. But my bone is what to my skeletal muscle? Deep to, right? Does it matter whether I start from the anterior or posterior? No, right? Because you're going from the outside toward the core with superficial and deep. Does that make sense? Okay, that's superficial and deep. So these terms you're going to use all semester. And again, pay attention to the legends when you're looking at images. Because, for instance, there's multiple layers of muscles in your abdominal musculature, and some of them are superficial to other ones, and others are deep. And you'll be like, why the hell can't I see the internal abdominal oblique muscle? Well, because the external abdominal oblique muscle is superficial to it, and it's covering it, right? So you need to kind of understand how those relationships exist, read the legend, right? And if you're looking for the internal abdominal oblique, you're not going to look for a superficial image, right? Or a superficial dissection. You're going to look for a deeper dissection. Is that okay? Okay, so you're going to run into those this semester as well. All right, regional terms. So these, how many of you guys have already been to lab? Yeah? Okay, about half of you have already been to lab. The rest of you guys will go to lab this week. You are learning the same regional terms in lab as in lecture. They're the same. And they are related to these. Did you guys start looking at these in lab? So basically, there's a specific anatomical term that all of us experts would use to refer to regions of the body, okay? And sometimes it's like super obvious which ones they are. Like nobody's going to be surprised that that's the pubic region, right? But you probably haven't run into the fact that the anterior aspect of the elbow is called the antecubital region, right? And that's okay because you can learn it now. Femoral is pretty obvious, right? Probably doesn't surprise you that carpal tunnel syndrome happens right here, does it? Okay? All right, so you're going to learn all of these anterior and posterior, and why. Why on earth am I making you do this? Because this semester you are, for instance, going to be looking for the median antecubital vein. And because we did this, you are not going to go looking in the ankle, are you? No. You are going to be looking for the median antecubital. Where the hell should it be? Right smack down the middle of the anterior aspect of the elbow, right? Does that make sense? You are going to be looking for the popliteal. There's a mistake on this one, so don't get thrown by it, by the way. It's not in popliteal. You're going to be looking for the popliteal nerve. Where are you going to look for it? Back of the knee, exactly. So you are learning these things because the anatomical structures that you are running into this semester are going to be named for these body regions more often than not, right? And it gives you some confidence. There is one mistake. It's not a mistake in your textbook. It's a mistake on the image that they sent me. Do you know that the front of the leg, by the way, this is your leg and this is your thigh, okay? The front of the leg is called crural. But this is wrong. Somebody tell me what the back of the leg is actually called. Sural. I don't know why they just sent me the wrong image, but you got the right thing at home. You got it, okay? Everybody good? Okay, so you're going to learn all of those. Same ones you have to learn for lab. You had to learn them anyway. And then the other thing that you probably touched on in lab, but is not like a specific body part, it's just like regions of the body, is the terms axial and appendicular. And those are like bigger concepts. So let me explain what those are. Axial is, so we said that I had an imaginary line that I could use to divide me into left and rights. I also have an imaginary axis on my body that if I put an eye bolt in there, ouch, hung myself from the ceiling, if I got it in exactly the right place, I would actually hang relatively well, right? That's the long axis of the body, okay? All of the bones, musculature, all of the anatomy that is associated with the long axis of the body is considered axial. Yeah? That makes sense? So all my cranial and facial bones, my vertebral column, right? All of the musculature and everything that's associated with that, that's all axial. So when you guys start skeletal system, which is week after next, you will do a week of axial skeleton and then a week of appendicular skeleton. So what's appendicular? Appendicular is associated with your appendages, right? So all of the bones and muscles here and here are appendicular, yeah? And so when you get to muscles, you're going to do a week of appendicular and a week of axial muscles, yeah? Now, I'm not going to try to nitpick you about this or trick you about this, but I do want to tell you that sometimes counterintuitive things happen. Like, for instance, it should make sense to everybody that this is all like appendicular bones and muscles, yeah? But the clavicle and the scapula are actually appendicular because you wouldn't have them if you didn't have an arm. They're there to hold on to your arm, right? The same thing with this pelvic girdle. This is actually considered appendicular, right? Now, nobody nitpicks you by the time you get to that because you've got enough crap to remember when you get to muscles. But it ends up with things like that are kind of a little maybe counterintuitive, like what the hell kind of muscle is a deltoid? Because it starts here, but it goes all the way to there. What is it? Well, not that you care or anybody's going to count it wrong if you called it one or the other, but it is there to move the humerus. So now what do you think it is?
Appendicular.
Yeah, it's appendicular, right? Like, does that make sense? Okay. But I don't tend to try to trick you about that. It's just that sometimes you can see things listed in a way that might be counterintuitive, right? A muscle that you thought should be in that list isn't in that list and is in another one. That's why. It has to do with functionality and what they're there for.
So where
Okay.
does it end on axial? Like where in your trunk? Like, does it include your butt or no? 'Cause that's where your
No,
legs
interesting.
stem from.
So that's a good question. I mean, we won't ask you about this, but conceptually, how about all my gluteal muscles? Those are only there to move my leg. So those are actually appendicular muscles. So the muscles that are actually considered axial kind of are just to the bottom right here until you start wiggling your legs, right? Okay.
So is pelvis out of that then? Is that not
The
axial?
middle of your pelvis is actually considered axial, and then these muscles out here, they're all appendicular. But again, nobody's going to torture you about that. Just like why they might be in one list versus another, okay? I mean, somebody might torture you about that, but it's not going to be me, Okay, so that's axial and appendicular. Okay, next thing we are going to do is to talk about the fact that we said before that you can't see everything without cutting. Yeah? So there are specific terms for different types of cuts that you can make to see stuff. So I want to talk about that. So I need you to imagine with me that we are going to take a plane, like a big flat knife or a plane of glass, and I'm going to use that to cut something, okay? But what I'm really interested in is the cut edge, yes? Otherwise I wouldn't have cut it at that place. Does that make sense? Okay, so you use a plane, yes, to make a section, yeah? So we'll get to the terminology in just a second. If I sliced myself right here, I would have been using the sagittal plane to produce sagittal sections. Does that make sense? That's how those terms are related to one another. So the cutter is the plane, the result is the sections. Got it?
Is that specifically a vertical section?
It is, and I'm going to talk about, that was just an example I haven't actually taught you yet, but I'm just, yes, that one is a longitudinal or vertical section. So give me a second and I'm going to describe the specifics. I'm just trying to tell you the relationship between the terms plane and section right now.
So the cutter, you said the cutter is
The
the
plane.
plane,
And the result, the cut edges that you're looking at, those are the sections.
Okay.
Got it? Okay. So let's talk about that. So now her question was, there are specific kinds of planes of section, yeah? And so we're going to start learning those. So basically, long axis of the body, right? Okay. Any plane of section that is parallel to the long axis of the body is called a longitudinal or vertical plane of section, right? And there's a lot of different ways to be parallel to a line, isn't there? Right? You can be parallel this way, but you could also be parallel that way, right? Okay? So if it's parallel to the long axis of the body, it is generally called a longitudinal or vertical plane of section. Everybody okay with that? Okay. But you can get more specific than that. Okay? And we're about to. So, as far as longitudinal or vertical planes of section go, there's two really common ones that you're going to run into. And there is one that slices this way. Okay? If it slices this way, it divides the body into what and what parts? Anterior and posterior, or what's the other pair of terms that would be?
Dorsal,
Yeah, dorsal and ventral, exactly. Okay? This plane of section is either called a frontal or a coronal plane of section. Both are really commonly used. Corona, anybody who speaks Spanish? No.
crown.
Crown, yes. It means crown, right? And if you're from Texas, it means the beer that has the crown on it. Right? That you drink with a lime on a boat in the summer. That's what you do. So that's coronal. It's more like a tiara, right, than a crown. So is there such thing as a mid-coronal plane? No, you don't really have a midline that way, right? So you could have a series, right? Because you don't have mirror image, anterior, posterior. But you can make several different coronal. Now, why would you do a coronal one? Well, a coronal plane or section would be a fantastic one if I needed to see all four chambers of the heart, right? It wouldn't be good to slice it this way, no? It would be good to slice it this way, right? So again, read the legend, because sometimes it's telling you how it was sliced. If I was looking at a picture that showed me all four chambers of the heart, it would say human heart, comma, coronal section. Maybe even anterior view, right? Does that make sense? So it's trying to like give you an expectation of what you're actually seeing. Okay, so that is frontal or coronal. And then the other one that you really commonly see is sagittal. And sagittal is really commonly misspelled. 1 G, 2 T's. Okay, so a sagittal plane produces a sagittal section. And if it's sagittal, what it does is it's going this direction. That's how my plane is going. So it divides the body into what and what parts? Yes, left and right. Okay, does that make sense? Okay, so, but I can be even more specific with sagittal because I do have a midline with sagittal, right? Don't I have a midline this way? Okay, so if I'm right smack in the middle, it's called, to be more specific, a mid-sagittal plane or mid-sagittal section. And it divides the body into equal left and right parts. Yeah? But if it's decidedly off the midline, like on purpose, right here, Okay? It's called parasagittal because it divides the body into unequal left and right parts. Why the hell would I want to do that? Well, what if I actually needed a section right through here so that I could see something that was going on with the tear duct? What if I wanted to see that part? What if I wanted to see this particular portion of the brain? What if I actually wanted a section that went through my right lung, not between my lungs, right? Then it would be parasagittal. Okay, so now what happens is I need to teach you something important, and that is in anatomy. It's important for you guys to understand that if there is a more specific answer, the general answer is wrong. It's not part right, it's wrong, okay? And so here is the way that I will quiz on that kind of stuff. If I showed you an image and it had a picture and it was obvious that the section was right about here, or maybe even right about here, and I said, identify the type of plane of section that you've got, what possible answers would I give you? Every single reasonable answer that you could make is a mistake. I would put longitudinal, yeah. I would put coronal, sure. I would put sagittal, mid-sagittal, parasagittal. We'll put all of those, right? Because your job is to figure out the most correct answer, right? And the most correct answer in that situation is what? Parasagittal, right? That makes sense? And I'm not going to give you partial credit either. And why? Is it just because I'm a jerk? Maybe I am a jerk. But I also want you to know what the hell you're doing when you're taking care of me, right? You're not just going to like almost get it right. Well, I almost got your liver, right? Well, no, I was really specific about the whole liver thing. And apparently we need to be specific because she had your liver mind, a brilliant person, not that part, over on the other side, okay? I know you're really smart, but I don't know how the hell you got to work, right? Do you know people like that? So brilliant, really, really need someone to hold their hand whenever they're not doing something specific to their discipline. I find them very charming as long as they don't live in my house. Okay, so, and then the last sections are the easier ones. A transverse or horizontal plane of section. Transverse or horizontal plane of section is a plane of section that divides the body this way. Not parallel to the long axis, but perpendicular to the long axis, right? And you guys, if you don't know what perpendicular means, and English is your native language, if English isn't your native language, I am happy to tell you that you probably know other words that I don't know for it. But what it means is it's at a 90-degree angle, right? 90-degree angle. Every single semester, people are like, what the hell is parallel and perpendicular mean? What are you talking about? And it's English speakers, people. So perpendicular to the long axis is called horizontal or transverse, or sometimes they just call them cross sections. Cross sections, okay? Transverse and horizontal. And that divides the body into what and what parts? Superior and inferior, or other pair? Cranial and column. Cranial and column. Yeah, exactly. That make sense? Okay. And then every once in a while, sort of an accidental plane of section can occur. You don't do these on purpose, but they just happen. So if I was like doing a section through my torso and slicing my entire small intestines, right? Does it make sense that because of the way it's curved, you would probably get some longitudinal sections, yeah? You probably get some cross sections or transverse sections, and you get some sections that weren't either longitudinal or cross sections, they would be oblique, kind of at an angle. Go ahead.
So one of the lab aides described it as maybe a diagonal.
Yes.
Okay.
So we're going to practice that in just a second. Okay, you ready to practice? So I'm going to admit to you one of the many weaknesses in my intelligence. Everyone has them. Everyone has strengths. I am a very spatially challenged person. It's not 2:20. We leave at 2:20.
It's just we're going to the next page of the note.
Oh, okay. I was like, all right. If you're going to leave early, you better sit back there. That's all I'm saying. Okay? All right. I got some shit to do. Okay. So I am really, really bad at 3D imagining. Have you seen those questions that are on like IQ tests that they're like, here's a 2-dimensional rendering of a 3D structure. What does it look like if you rotate it 270 degrees clockwise? I didn't even know people could do that. I think it's a superpower. I don't know how the hell you do it at all. Like my husband gets them right every time. I just guess C. I don't even know. So I'm really, really super bad at that. And it's actually, interestingly, it tends to be kind of sex specific, that skill. It's not like every man can do it and every woman can't. It's just that women tend to have other strengths. We're also far more verbal. We usually have larger vocabularies than the men in our lives. But our spatial imaging is usually not as strong as it is in a group of men, which pisses me off. I don't like anything that I can't do better than everyone if I try. But that's one. But there's a way that you can get better at that, by the way. Guess what it is? Research. Research says first-person shooter video games. I play them with my 12-year-old, and he has to come rescue me all the damn time. He's like, Mom, why the hell did you fall off that thing again? I was like, I don't know, I didn't see it. What was it? Was it there the whole time? So here's the deal. If you're already good at this, then this is going to be stupid to you. If you are, I sense that Chenny is not good at this. She's got other amazing qualities. So we're going to practice this together. It'll be super obvious to some of you, and some of you will be like, I don't know what the hell you're talking about. So I want you to imagine a tube because there's a whole bunch of tubes in the body, yeah? It's an empty tube. Let's say it's a tube that's straight, like your esophagus, okay? Here's what I'm interested in. I'm interested in the tissue that is lining the inner surface of the esophagus, and I can't see it without cutting it. Yeah? Can't see it, okay? So I'm going to do a couple of different types of cuts. But what I'm going to do is I want to look at the tissue, so I need to look at a histology slide, yes? Yeah, I need to look at a histology slide. But my challenge is there's going to be a bunch of crap on that slide. I don't want to spend 20 minutes looking at my eyelashes or something that I'm not supposed to be looking at like everyone does. So I'm going to tell you that I'm going to do a longitudinal section of this tube. Here's my question. What am I looking for on the slide once I put it on there? Okay, I made a human esophagus, comma, and the slide says L.S. which means it's a longitudinal section. What structures, what images, what shapes am I going to tune into? Any idea? Has to be really, really thin. I did a longitudinal section of this tube, and I'm interested in the cut edges. What am I looking for?
Do you cut a piece out of it, or you just cut it and
you have to, that's a good question. You have to cut a thin piece, so you have to cut a piece out of it. So tell me what I'm looking for.
What's on the edges and what's on the surface of the inside of it?
Yeah, what shape will I see on the slide? No, what shape am I, tell me. Go ahead.
Like a straight section.
Parallel lines. Yes, parallel lines. What's going to be in the middle will get my attention because it'll be bright light, because it is a lumen. There is no tissue there, yes? Yeah? And the tissue I'm interested in is going to be here, yeah? So do you think it's helpful to know that I am actually looking for a bright white line, right? Because is there a bunch of crap you're not interested in over here, and there might even be a circle over here, right? No, you need to know that what you're looking for is a longitudinal section of a tube. And the tissue that you're interested in will be right next to the white space, right? Okay? But you could look at the same organ with a different type of section. And again, you will save yourself some time and frustration if you have an expectation of what you're going to see on the slide. So now, instead of doing a longitudinal section of the esophagus, I'm going to have a slide that says human esophagus, comma, X.S. or C.S. which means cross section. Same thing as transverse section. What do I tune into on the slide? What am I looking for? Circle, yes, good. I'm looking for a circle. Bunch of distractors out here. I'm looking for a circle. White lumen in here. Where's the tissue that I'm interested in? Yep, right next to the lumen. Yep, that's the tissue that I'm interested in. Okay. Can your lab instructor ask you the same tissue from this section and that section? Of course, it's the same tissue, right? And last but not least, what about an oblique? This is what Chen was asking about. What about an oblique section? It means that I tried to get either a longitudinal or a transverse and I didn't quite get it. So what happens if I take this tube and I cut it at an angle? Yeah, I'm getting an oval, exactly. Getting an oval, again, white space. So here's what some people do and good students do not do. Some people memorize the picture that was in lab and say, that's what simple cuboidal epithelium looks like. No, it's not. That's one iteration of simple cuboidal epithelium. You can section it differently. You can have it closer up or further away, right? You can have an oblique section. You can have any kind of section. So once we get into histology, I am never going to use pictures that you have seen before to quiz you. I will teach you a mechanism that allows you to identify every single time you see a new picture, right? So that you don't just memorize an image, okay? Okay, so this is what people like me had to do to figure out what the hell the tubes all have to do with one another. And then next time what we're going to do is we're going to start on body cavities and membranes. We'll start right here next time. So your objective between this time and next time is to start working on the prefixes, roots, and suffixes, right? Start practicing all of the stuff on this set of notes. You'll have a quiz a week from today. It'll be over this entire set of notes, plus prefixes, roots, and suffixes. And don't miss lab, okay? Have a great weekend.
Okay.